Is medication overuse a risk for those with episodic migraine? Have you ever wondered if taking too much medication for migraines could actually make things worse? This is a common concern for those who experience episodic migraines. Medication overuse is indeed a significant risk for individuals with this condition. It can lead to what is known as medication overuse headache or rebound headache. This happens when acute headache medications are used too often, resulting in more frequent and severe headaches over time. So, how does this cycle begin? When individuals with episodic migraine take headache relief drugs more than recommended, they may find themselves caught in a loop. Typically, using these medications more than 2 days a week or 10 days a month can trigger medication overuse headache. This is particularly concerning for those with episodic migraine, as they often relying on acute medications to manage their attacks. Some of the medications most commonly linked to medication overuse headache include triptans, ergotamines, and combined pain relievers that contain caffeine, aspirin, and acetaminophen. Butalbital-containing drugs and opioids are also part of this group. Simple analgesics like acetaminophen and non-steroidal anti-inflammatory drugs have a lower risk but can still contribute to the problem. The risk varies depending on the medication type. For example, triptans, opioids, and butalbital-containing drugs tend to have a higher potential to cause medication overuse headaches. Newer treatments for migraines, such as gepants, seem to be less likely to lead to this issue. What happens in the brain during this process? Frequent use of medication can temporarily raise the pain threshold. However, over time, the brain may recalibrate, causing normal stimuli to be perceived as painful. This can lead to an increase in headache frequency, making the situation worse. For those dealing with episodic migraine, managing medication use is essential to avoid medication overuse headache. Experts recommend limiting the use of acute headache medications to no more than 2 days a week. If someone develops medication overuse headache, treatment usually involves withdrawing the overused medications under medical supervision. This can help restore the brain's normal pain processing and reduce headache frequency. In summary, medication overuse is a clear risk factor for worsening headache patterns in those with episodic migraine. Careful management of medication intake is critical to prevent progression to chronic headache conditions.